name is Megan Knight, and today I'm going to talk to y'all about why you shouldn't smoke cigarettes. I'm going to explain to y'all the effects that smoking cigarettes can have on your body. To start off with, I'm going to talk about how smoking can diminish your health. To start off with this, I'm going to talk about how it can increase your chances of autoimmune diseases. Autoimmune diseases are things that compromise your immune system. An example of that is a respiratory infection. Also, Crohn's disease and rheumatoid arthritis are examples of autoimmune diseases. And if you smoke, it doubles the risk of you getting rheumatoid arthritis. My grandmother smokes, and I have never heard that smoking can put you at higher risk for Crohn's disease or rheumatoid arthritis, but she actually has both. Also, smoking is linked to type 2 diabetes. Next, I'm going to talk about bones. Smoking can decrease the bone density, which makes your bones brittle. And because your bones are brittle, it can actually form into osteoporosis. And that is where your bones are so brittle and they're so not dense that they're easily fractured. And bone loss is very common in smokers who have smoked for a very long time. Next, so heart and blood vessels actually are harmed by smoking cigarettes, and so are your lungs, but I'm going to talk about that in a different section of the speech. Smoking actually can alter your vision. It can cause cataracts and optic nerve damage. Both of these can hinder the way you see, or it could even turn into blindness. Smoking can also cause cancer, which is what everybody associates smoking with. There's actually 7,000 chemicals in a cigarette, or around 7,000, and 70 of the chemicals that are in cigarettes actually are cancer-causing chemicals. The number one risk of smoking cigarettes is that it can cause lung cancer. Next, I'm going to talk about your lungs. So smoking can damage your lung tissue, and damage to your lung tissue, no matter if it is smoking cigarettes or not, it can cause the damage, which is very irreversible. No matter if a doctor says that he can fix it or try to fix it, there's never a 100% cure for the damage. But smoking can actually scar and damage your lungs. Chronic pulmonary disease is where you wheeze, you have shortness of breath, and a tightness in your chest. My father's father actually had COPD, and my mother's father had COPD, and eventually it progressed into lung cancer. Also, smoking cigarettes can put you at a higher risk for emphysema, which is where the walls between air sacs in your lungs lose the ability to stretch and shrink back to their normal size. And it destroys your lung tissue, which makes it impossible for you to breathe. It just makes it a lot harder on your lungs. Smoking can actually cause chronic bronchitis, which is swelling in the lining of the bronchial tubes, which most people associate chronic bronchitis with smoker's cough, which is that very harsh, nasty sounding cough that most smokers have. 80% of lung cancer cases are because of smoking. Next, I'm going to talk about smoking and the damages it can cause to your heart. Smoking can put you at a high risk for, forgive me if I say this wrong, atherosclerosis. Probably did. But it is where plaque builds up in your arteries and it's harder for the blood to flow through. Also, smoking cigarettes can cause aneurysms, where bulging vessels can burst, and once these vessels burst, you have to be very fast about getting them treated, or else it can cause death. Smoking cigarettes can also cause cardiovascular disease. Factors associated with cardiovascular disease are heart attacks, heart-related chest pains, high blood pressure, And also, coronary heart disease is also associated with cardiovascular disease, which is where your arteries are narrow and they're blocked as well, so the blood makes it is harder to flow through. Peripheral arterial disease is caused by smoking, and it is where plaque builds up in the arteries that carry blood to the head, organs, and limbs. And if blood can't get to your head, organs, and limbs, they're very vital to your body, and it can cause lots of problems. Also, smoking can cause strokes, which are sudden death of your brain cells, which can cause blood clots and heavy bleeding. 1 out of 5 deaths from heart disease is from smoking. So just think, if you didn't smoke that cigarette, that's just 1/5 of a chance that you would have to live longer. Next, we're going to talk about dental health. Most people don't associate dental health with heart disease or with smoking cigarettes, But since I am going to school for dental hygiene, it's something that I think about. Most smokers that you see, their skin is very discolored. It's got a lot of dark spots. They have bags under their eyes, stuff like that. Well, for the dental health wise, we're going to talk about how they have bad breath, which of course it smells like cigarette smoke, but it also has a very other distinct smell to it. Their teeth can be very discolored. They can be a yellowy, if not orangey color. They have an increased plaque and tartar on your teeth, which is the white cakey buildup that's on the teeth. Also, you can have a loss of your jawbone. It puts you at a high risk for gum disease. It can also put you at a high risk for oral cancer. Okay, and then when we're talking about how smokers look, well, smokers, they have bags under their eyes because they do not feel very well rested. Even after they have a long night's sleep, they still don't feel rested. They have psoriasis, which is where your skin gets very dry and scaly. No matter how much lotion or anything like that you put on it, it's hard to get rid of. You know, it has to be uncomfortable. Their clothes have to pull on it, stuff like that. Smokers' teeth look so bad because of the nicotine, and the nicotine is actually what changes the color of their teeth. The nicotine can actually yellow their fingers and their fingernails, where if somebody smokes for a long time, just look at their nails and they'll be a different color, especially the ones that they hold the cigarette with. Smoking cigarettes can also progress the aging cycle on your skin, where you'll have a lot more wrinkles, a lot more sagging on your face. Also, smoking can make your hair be a lot thinner. It can cause skin cancer, and also it can produce warts on your skin that normally wouldn't be there. So I don't associate a lot of these things with smoking until I started to look up stuff for this speech. But now that I have, I wouldn't smoke anyway, but this just helps me know to a little bit more. Does anybody have any questions? Okay, if not, that's all. Thank y'all.